My name's Simon Scrivens. I'm Global Head of Marketing for Healthcare for Sodexo. I'm based in London, England. That we all, as patients, as human beings, have to take responsibility for our own healthcare. Let me give you an example. We know that there is an explosion globally in the incidence of type 2 diabetes. Type 2 diabetes is fundamentally preventable through diet and exercise. We know that the pharmaceutical treatments for diabetes do not have great outcomes. So compliance with metformin prescriptions is not good. As Sodexo, we know that executing diabetes prevention programs using CDC protocols reduces the incidence and seriousness of type 2 diabetes. We know from work we've done in the US that figuring out as a healthcare provider how we engage with patients in ways that are appropriate for that individual patient, in ways that work around patients' complex lifestyles, has good benefits for the patient, and as importantly, has good benefits for healthcare systems in reducing the overall cost to treat and manage and avoid type 2 diabetes. Our DNA is in food and nutrition. So in 39 countries, we feed patients every day in hospitals and at home. In addition to that, we have grown our business to include cleaning and housekeeping and infection control services. We include a number of engineering services, so infrastructure engineering, looking after hospital buildings, and medical equipment engineering, looking after everything from infusion pumps to MRI and CT machines. Additionally, we're developing capabilities in home healthcare by employing large numbers of nurses, providing support care and clinical care to individuals in their own homes. We believe that the primary focus has to be on patient safety. So every service we offer has a fundamental focus on safety of patients. After that, we believe that ensuring patients have as good an experience of their healthcare episode as they possibly can is really important. In some countries, there is a strong link between patient-reported experience and the financial compensation that hospitals receive, and we help hospitals improve patient perceptions of care in order to maximize the income available to those hospitals. So everywhere, healthcare expenditure is growing, and that's for a variety of reasons. The two main reasons are in countries like India, where governments have, over a number of years, promised the electorate more spending on healthcare, better access to healthcare. So that results in significant growth in healthcare provision and significant potential growth for us in the services we provide to hospitals and patients. The other reason healthcare expenditure is growing is in Europe and the US particularly. The aging population, usually with significant multiple comorbidities, is resulting in a massive increase in healthcare spend. All of those things are good for our business in providing services to hospitals. But specifically, what we're seeing is an explosion in what I call healthcare consumerism. So patients are requiring not only access to healthcare, but choice about which healthcare provider they choose, which physician they choose, and in some cases, what procedures they're going to undertake. So the idea of more money going into healthcare and the idea of patients being more selective and acting more like traditional consumers imposes a kind of conflict in the healthcare space. So in every country in the world, we are seeing huge pressures on cost. Now, whether that is driven by more people accessing healthcare and being enabled to access healthcare, or whether that is because people are living longer and being sicker for longer, that tension is very obvious in every country. So the challenge for healthcare providers really is to do more, do it better, and do it for less money. And our proposition to healthcare providers is largely about doing those things. So can we do it better? Can we do it faster? Can we do it at lower cost? Whilst at the same time making sure patients are safe and making sure that their reported experience is as good as it can be. So I think patient-reported experience is, every hospital will tell you that patient-reported experience is important. It is honestly more important in some countries than others. So in the US, we see patient experience being linked, hardwired to hospital revenues. And so hospitals invest considerable sums of money in ensuring patients report a good experience. In other countries, there is significant competition between hospitals, and so again, patient experience becomes important. At the end of the day, the services we provide mean that we have, as an organisation, more touch points with patients than almost any other part of a hospital organisation. So whether that is a cleaner going into a patient room, whether that is a food service worker providing a meal, whether that is a porter taking the patient to another part of the hospital, or whether that is somebody coming in to assess the performance of the hospital, all of those things are patient touch points, and we are working hard to make sure that we firstly value those touch points, and secondly make the most of those touch points from an experiential point of view from the patient, but also from an information and data point of view from a hospital perspective. So gathering data and information both qualitatively and quantitatively from patients about their experience, whether that is about something simple like breakfast was great, or whether that is something slightly more complex about my pain management was terrible today, that data is useful to hospitals, and we are facilitating making that data and that information available in a way that hospitals find actionable, so that they can do something with it in the moment rather than waiting for a letter complaining about their treatment from a patient 6 weeks after they were discharged. India is an important marketplace for us. We've been growing very rapidly over the last 4 or 5 years, and we see huge opportunities across the range of our traditional services. But more recently, we've introduced our clinical engineering proposition into the state of West Bengal, and we are seeing significant improvements in equipment availability and reductions in lifetime cost of ownership as a result of that proposition. So we think our focus in India for the next couple of years is going to be infection control and clinical engineering.